Good morning, everyone. Thank you for joining us for our Healthcare Reform Readiness webinar. We actually have Clifford Watkin on the line. He's going to be giving us a presentation on what to expect in 2014 and what steps we can take to be compliant. I definitely give the floor to him. We do hold questions at the end, so he will have a Q&A session. On your box, you can actually type in your question at the bottom, or you can raise your hand and I can unmute your mic so you can actually ask your question towards the end of the webinar. Clifford?
Good morning. Thank you, Bridget. Welcome everybody to the webinar this morning on healthcare reform readiness. As Bridget had said, I'm Clifford Watkin. I'm with Ipswich Bay Advisors. We're a integrated human resources, employee benefits, and financial services firm. And those three pieces of our business cover the full spectrum of human resources. On the HR side, we provide compliance, HR consulting. We provide HR administration with regards to terminations, enrollment, billing, so on and so forth. On the HR side, we also provide compensation consulting, anything to do with HR, strategic planning, all under that umbrella. On the employee benefits side of our business, we provide benefit plan packages for employers with regards to contribution strategies, as well as selecting different vendors and costing out the prices for those benefit plans. For the retirement side of our business, we also provide corporate retirement plans to employers, and that includes the compliance, the administration, the investment advisory services, as well as the employee education. So we cover the full spectrum when it comes to HR and employee benefits. A little bit about our firm. We've been in business for over 15 years. We have clients across the country, and most recently we were awarded the great honor of one of the fastest growing investment advisory firms by Forbes magazine. So a nice little accolade for our organization. But jumping into the presentation, what I'm going to do is talk a little bit about what we're going to cover today. Healthcare reform is going to affect employers' hiring decisions. We're going to talk a lot about that today. There's a lot about the legislation that's going to cause employers to think about healthcare reform and think about hiring as they think about their staffing needs for 2014. Healthcare insurance renewals are also going to be impacted next year significantly. We're going to talk about what those impacts are to employers, and so from a budgeting and financial planning perspective, health insurance renewals are going to go up. There are now new communication requirements that employers have to pay attention to, as well as reporting requirements that employers are now going to have to file specific reports with the government as a result of healthcare reform. And most importantly, employers need to stay compliant with the legislation and keep up to date with the ever-changing and evolving healthcare reform. Healthcare reform has been called many things over the past couple of years. I'm going to just generally refer to it as healthcare reform, but on this slide you can see the acronym PPACA, and that's for the Patient Protection and Affordable Care Act. And so generally when we talk about healthcare reform, we talk about it as today the largest social piece of legislation since Social Security. And if anybody can remember, Social Security was signed into law August 14th, 1935. And actually tomorrow we're going to celebrate its 78th year being in force. So healthcare reform is one of the biggest next to Social Security legislation in terms of how much it expands and it extends to all organizations. It affects employees, it affects employers, it affects healthcare providers, and we're talking about doctors and hospitals and hospital networks. We're also talking about pharmaceutical companies, All of these organizations are significantly impacted by healthcare reform. When you look at the legislation that's been passed in prior years, many of it has been reactive. So, for example, if you look at COBRA legislation, that was passed to help address employees who were losing coverage when they lost their job or a change of status and so forth. This legislation is much more prospective in terms of affecting how we're going to operate as an individual and as an employer in the future. And for the first time, this piece of legislation is requiring employers to think strategically because this legislation is affecting all of the human resources components within an organization. We're talking about managing change here. And for many HR professionals, we're always talking about what's the workforce strategy. Where are we within an organization? And I always like to use the slide to just create a framework for HR workforce strategy, and then also all the things that are impacting it, specifically healthcare reform. So if you look at the slide on the left-hand side, the beige circle has the words organizational culture, business strategy, human resources strategy. That's the big piece of an organization that's typically, and those strategies are typically driven by the key executives of the organization, especially the business strategy, the human resources strategies driven by the HR executives, and the organizational culture is driven by the employees. They're the ones who define what the culture of the organization is, and generally every organization has its unique own culture. Within that, those strategies our organizations develop what we call our total reward strategy, and this is made up of the 5 components: compensation, benefits, work-life, performance and recognition, development, and career opportunities. And all these five components make up how we're going to reward and motivate and attract and retain employees. And from the employee's perspective, they're looking for satisfaction and engagement. From the business, they're looking for performance and results. And the two work together within the organization under the umbrella of the total reward strategy. So when we talk about healthcare reform and how it's now going to affect benefits, it's going to affect performance management, it's going to affect work-life balance. There's many pieces about the legislation that are now going to impact our total reward strategy. So again, when we talk about managing change, we're not just talking about a new piece of legislation that an organization needs to remain compliant within. We are talking about how this legislation impacts our whole organization and our total reward strategy. Dating back to 2012, there have been a whole host of key dates that organizations have had to comply with. The first one being the claims and appeal process. Then there was the medical loss ratio provision where rebates were provided to small to medium-sized employers. The preventive health services for women came into effect with 0 copays for women's preventive services. Then the summary of benefits and coverage documents needed to be provided in September. And then for January of this year, flexible spending account caps at $2,500, and the Medicare tax increases for the highly compensated, and then retiree prescription drug expenses that went away. These key reform dates, I always like to advise my clients to use them as key communication opportunities. And this is not so much a key communication opportunity to just let them know what's going on. So, for example, sending out the summary of benefits coverage, or when the student dependent to age 26 came around. This is a great opportunity to let employees know about this provision, but on the flip side, let's use it as a call to action. Let's try and get some of our single young employees who are 26 and under off of our health plan and onto our parents' plan. If they have parents that are working and have a family plan, it's no cost to the family plan to get the kid on. It's a huge saving to our organization because we are now, as an employer, not responsible for paying for health insurance for that employee. So there's a key communication opportunity there to try and get or try to manage your health care costs with this key piece of legislation change. Again, in 2014, there is going to be, for this January, there's going to be an expansion of eligibility for Medicaid. And so anybody who's earning 133% of the federal poverty level, which tends to be around $30,000, may be eligible for Medicaid. And so it might be worthwhile taking a look at your salaries and determining whether you have a group of employees that fall within this category and, based on their circumstances, might be eligible for Medicaid. Medicaid is paid for by the government, so health insurance coverage to them is going to be paid for by the government, free to them, and there's no penalties to you as an employer to get those employees to enroll on Medicaid. Again, another communication opportunity to get employees to take advantage of health care through the government and lower your health care costs as an employer. Some other key dates as we look at 2013, Form W-2 reporting required for employers who have 250 employees and above. July 31st, this just came around, the comparative clinical effective research fees needed to be filed. I'll talk more about what those are. Coming up in October, we have the employer notice of the exchanges, which I'll talk more about as well. And then there's some HIPAA certification for December 31 for this year. Coming into 2014, we have the employer shared responsibility, which was supposed to take effect for January 1, but has now been delayed to January 1, 2015. And we'll talk more about that throughout the presentation. Automatic enrollment for January 1 is supposed to take effect. There's been some discussions about it possibly being on hold. We're not really quite sure, but that needs to be watched out for. That means that for employers with 200 and more employees, employees need to be automatically enrolled into their health insurance plan, and the employee has the option to opt out if they don't want the health care coverage. And then, of course, the big one, January 1st, 2018, is the Cadillac Tax that employers need to be concerned about with regards to a key penalty if you meet the Cadillac Tax requirements. We talked earlier about how the healthcare reform legislation has a key impact. These are significant laws that have taken place over the prior years, and as you look at them, in some way, shape, or form, healthcare reform is going to impact them with regards to whether you have to just evaluate these pieces of legislation and whether they impact your organization or not, and don't have to do anything. But healthcare reform is going to touch many of these laws that I have listed on the slide here. One, very, very simply, is with the auto-enrollment. If you as an organization need to comply with the auto-enrollment requirement, how does that impact Section 125? What are we going to do with regards to the Section 125 enrollment and the authorization and the opting out? So, again, there are key pieces of this legislation that are going to affect these laws that are already on the books. Many of us have heard lots of discussion recently about the healthcare exchanges. So what I'm going to do is just give a brief definition of what those are for people who haven't heard about it or are not so aware of it. A healthcare exchange essentially is a marketplace online where individuals can go online and buy health insurance. And the government is required if the state is going to be offering these exchange, they have to follow certain protocol with regards to the types of plans that they offer. So there is some sort of uniformity across all of the exchanges that are being developed. What you can see here on the slide is that there are three different colors. The beige color represents the states that have said that they're not going to build their own, and they're going to default to the federal exchange, which will be one exchange that those states will participate in. The dark blue represents the states that are going to be establishing an exchange, and the light blue represents those exchanges those states that are going to be developing a partnership exchange, maybe with a private employer, or it's not really quite sure as to how they're going to build theirs. But essentially, 18 states are establishing exchanges. 26 states said no, they're going to not do their own and participate in the government, and 7 of them are participating in the partnership exchange. And if you look at, not sure where everybody is, but in North Carolina, you can see that North Carolina is going to be participating in the federal exchange. So as an employee, I'm going to now be able to buy insurance from an exchange starting on January 1. And the issues that are coming to the forefront today is that it's almost September, and we need to have these exchanges operational for employees to be able to buy health insurance on January 1. So there's some concern about them being operational. That's what we're hearing in the news today. And there are also some issues surrounding states that don't offer the exchange and that they're going to use the federal exchange, because if an employee buys health insurance through an exchange and they get federal funding to pay for that health insurance, an employer may be subject to a penalty. And so the government hasn't really ironed out specifically how to handle if you are a state that is buying or offering health insurance through the federal exchange. So there's some big wrinkles that need to be worked out between now and January in order for these exchanges to be available for employees. And the most important one is that come October, employers need to notify their employees about the option to buy health insurance through the exchange. As we look at this new type of way to buy health insurance, an employee is going to be faced with, what do I do? Do I buy my health insurance through my employer, or do I buy my insurance through the exchange? And for the first time, employees are now going to be provided a decision support tool. In the past, up until now, some employers have provided decision support tools. Those are things like if you offer a flexible spending account, there might be a flexible spending account calculator where employees can go online and figure out how much money to set aside for their FSA contribution. Or if you're enrolled in a retirement plan, you might go online and answer a whole bunch of questions, and it'll help you figure out how much money to set aside for your retirement plan. For employers who offer HSAs or HRAs, they might have employees may have participated in a high deductible cost calculator. And then some employers who have wellness programs, those programs typically have an incentive modeling program to help them identify what plans to elect. So as we go forward into 2014, employers are going to be able to see more and more decision support tools to help employees figure out where they should be buying their health insurance from and what health insurance they should be buying. So this is going to be very new for employees, and employers need to be aware of these tools and make them available to their employees and decide which ones are the best tools to offer to their employees. One of the pieces of the exchange is that employees are now going to be offered insurance plans based on a gold, silver, bronze, and platinum level. So health insurance plans will fall into those 4 levels. and an employee will be taken through employees will be taken through a series of questions to help them decide which level they want to buy. There's one small inherent problem in this decision support tool, and that is when you rank plans by cost, inherently employees assume that gold is the best plan to buy. Unfortunately, it doesn't take into account the services that are provided and value or rank the plans based on the services that are provided. So it's important for employees to understand that they shouldn't be buying the plans based on cost alone. They should be buying the plans based on cost and which plan provides the best services to them. So that's an important component to make sure that employees have as part of their decision support tools when they're offering those plans to employees to buy. The next big part of the healthcare reform legislation is this notion of shared responsibility. And what it means is that large employers will be subject to an assessment, and I'll get into the definition of what a large employer is. But for the most part, most employers are going to be falling into the category of large employer. Employees who are working full-time are now going to be impacted. There's a new definition of what a full-time employee means. There's also going to be a premium assistance tax credit provided by the government to employees who buy health insurance through an exchange and cannot afford it. And that will impact the employer. There's going to be an impact to the employer who does not offer health insurance. And then if the health insurance is offered by the employer, there's now a new test that employers need to follow to make sure that this health insurance plan is affordable. So the shared responsibility has a lot of components to it, and we'll talk about many of those today. The penalty for large employers is that if you don't offer coverage, there is a penalty. If you offer coverage and employees have to pay more than 9.5% of their W-2 income for that coverage, there's a penalty. If any full-time employee receives a subsidy from the exchange, there could be a penalty. So for large employers, this is 50 or more employees. So the key piece here is to look at your workforce population, and these are 50 or more employees working full-time. And the definition for full-time is working 30 hours or more. So that's a big change for employers. And 50 employees, depending on the type of business that you are, takes into account the hours that people were working, not necessarily their status as full-time or part-time. It also takes into account seasonal employees. So it's important for employers to evaluate very, very carefully what type of employee we have and whether we meet this 50 and above threshold. So when you look at employers who are offering health insurance today, and let's just say we're an employer that's 55 employees, and we are offering health insurance, and we are asking our employees to pay half of the cost of the health insurance. For example, an employee health plan, I'm just giving an example health plan, for single coverage, let's just say it's $450 per month for the health insurance. That's $5,400 a year that the health insurance plan costs. So if we're asking employees to pay half of it, that's $2,700. 9.5% of somebody's salary paying $2,700 means that their annual salary is $28,421. There could be a good group of employees within your organization that are at that threshold. And so employers need to pay very close attention to make sure where are we with regards to that 9.5% of W-2 income in order to avoid the penalty. As we look at some more definitions, we look at the employee and the dependent definition. An employee means a common law employee, and most recently with the changes in the Defense of Marriage Act, employers now need to pay attention more closely to this common law definition, because now it applies to healthcare reform and it also applies to common law employees with regards to DOMA. There are some employees that are excluded. These are leased employees, sole proprietors, employees in a partnership, or 2% S corporation shareholders. They're not considered in your count. So when you're doing your 50 employee count, these people need to be excluded. Some more definitions about the dependent. This gives you a definition here as to students who are age 26. It's a biological child, adopted child, stepchild, eligible foster child, and there is some transition relief based on how employees are defining their dependents, which you can take advantage of in 2015. With regards to a dependent, they do not need to include the spouse for purposes of 4980H, and an employee can rely on an employee's representation with regards to who is a child. So the law doesn't specifically say that employees need to provide proof that these are my children. The law says that an employee can say these are my children. So here's I provide my clients some caution. As you enter into 2014 and you look at this definition of dependent, it's a good opportunity to do a little dependent audit. You as the employer have the ability to do that just to make sure that you are covering the right people. And because of this change, I recommend to my clients to do a dependent audit just to make sure that you're not covering the people that you shouldn't cover. Even though the law gives the employee the freedom, you as the employer have the right to do a dependent audit. There is the minimum essential coverage definition. We talked about this a little bit earlier, where if you are providing health insurance to your employees, you need to make sure that the plan provides or meets a certain minimum level of benefits. And when we talk about a minimum level of benefits, just to give you a very dramatic example, if you offered a health insurance plan that had a $10,000 deductible, that plan would not meet the 60% level of benefits that are provided to an individual. So this is an opportunity for you as an employer to work with your broker and your benefits consultant to make sure that the plans are actuarially valued and meet this threshold, because if they don't, then a penalty will apply with regards to noncompliance. With regards to the employer coverage offered definition, when you are going to offer health insurance to employees, employers do need to provide at least 95% of the Affordable Care Act full-time employees need to be offered this coverage. So you need to be very careful as to how you are defining who's eligible, and therefore ensuring that at least 95% of those employees are offered. As we talked earlier, there are now going to be reporting requirements, and these are the kinds of things that you're going to now need to report to the government to make sure that you're meeting these thresholds. Otherwise, if you're not, a penalty will apply. So the penalties listed below, it's a $2,000 penalty per employee minus the first 30 employees. So if you're a 50-person employee, the first 30 are not penalized, but the remaining 20 are. So if you just have one employee that was supposed to be offered the coverage but wasn't, the whole group is penalized, not just that one employee. So you have to be very careful about making sure that coverage is offered correctly. We did talk before about the 9.5% affordable definition. and figuring out whether any of your employees are paying too much for their health insurance. This does only affect people who are single, so you want to do that test and make sure that that applies. There are 3 safe harbor methods for determining earnings. There's the W-2 determination, which is basically looking at your W-2 earnings, and that's in box 1. There is the rate of pay determination, which looks at what people are paid in real time. This one's a little bit more tricky to do, but some employers might need to do it based on the type of employer population that they have. And note that this rate is not reduced by 401k or Section 125 contributions. And then there's the federal poverty level determination. So, for example, a family of 4, the federal poverty level for 2012 was $23,050. 400% of the federal poverty level would be $92,200. That would be your threshold that you would be looking at. And so just to take a look at the 400% of the family federal poverty level, the median household income is around $50,000. So there's quite a big swing there between the $50,000 and the $92,200 to determine how to use this as part of your calculation. So I'm not saying one of these 3 is better than the other. It all really depends on your type of organization, but the legislation is providing you with 3 safe harbor opportunities to determine how employees meet that 9.5% threshold. So determining full-time status. Employers are now going to be required to look at employees in a different light. So all the policies and provisions that employers have put in place with regards to eligibility for full-time status now have to be redefined. And what that means is that if you're an organization that has defined your employees as full-time as 35 hours or 40 hours or 39 hours, whatever that number is, now has to relook at that and determine and be redefined as 30 hours. So here, healthcare is now going to be defined as being 30 hours to be eligible. What employers need to do is they need to look at that eligibility and compare it to all the other benefits and policies that employers offer, and look at the eligibility for those and determine whether those need to be changed. So it's not only just changing the eligibility for health insurance. That change causes employers to have to look at other benefit plans and their eligibility. There are 2 ways employers can determine full-time status. You're now going to be required to calculate full-time status and record people's hours every month and report them to the government. So there's 2 ways to do it. There's a real-time calculation and a look-back calculation. The real-time is going to be probably unlikely used by employers because it's more complicated. The look-back approach is much more appropriate, and many payroll companies are designing reports so that employers can use the look-back approach. The real-time approach can result in employees moving in and out of eligibility on a monthly basis, and that could become too complex and costly for employers. Plus, there's a COBRA activity impact there. The look-back approach minimizes this issue because it allows you to look at the calendar year month beginning 12 months previously to determine whether employees are full-time or not. So here's the definition for a full-time employee: an average of 30 hours per week, or at least 130 hours of service in a month. Employers are now going to need to keep permanent tax records of this status. And why is this important? Well, what's going to happen is that you're going to define your employees as full-time, and you're going to record that in your payroll records. And the government is now going to operate their exchanges, and they're going to do a reconciliation of your eligibility and those employees that decide to buy health insurance through the exchange. And this reconciliation is going to be done in the future. So if there are any discrepancies, or if you have to prove that an employee was really a full-time employee or really a part-time employee, you're going to need to go back quite some time to prove that and show those records. And so it's important for employers today, even though this provision, this piece of the legislation has been delayed to January 1st, 2015, I recommend to my clients that they start doing this now. If you're not recording hours on a monthly basis and so forth, and it would be a good practice to get started, and because that's a big change for an organization. So get the employees used to it so that when you do have to comply by January 1st, 2015, you're already in place and it's not such a overwhelming task. There are some different measurements for these administrative periods that employers can use. They fall into categories of employees who are in separate collective bargaining agreements, or both collectively bargained and non-collectively bargained. There are both salaried and hourly employees that you now have to look at with regards to this look-back period. And then you also have to look at employees' primary places of employment based on the different states and the exchanges. So this full-time eligibility determination requires a lot more of evaluation and impact to the organization beyond just determining, oh yes, we have these employees working 30 hours and above. In 2018, the Excise Tax is going to go into effect. And I bring this up now, even though it's 2013, because employers really need to pay attention to the costs of their health care plan. And this is the total premium cost. It has nothing to do with what the employee pays or the employer pays. This piece of the legislation says that if an employer has a health care plan in 2018 that costs more than $10,200 for single coverage or more than $27,500 for family coverage, they will be assessed a 40% penalty of the costs of the health plan, which can be significant. And I bring this up now to show you very, very quickly how healthcare costs today, just based on the averages, are going to, if nothing is done to manage those healthcare costs, come very closely to the 2018 cap. So as you can see, what I've assumed here is that based on healthcare plan costs in 2012, these are average healthcare costs provided by the Kaiser Family Foundation, their health benefit survey. An individual health care plan today costs $5,615 for single coverage and $15,745 for family coverage. The piece of the provision looks at healthcare costs, not only just the premiums that employers pay for the total health plan, but also the FSA contributions that employees make towards their FSA plan. So on average, an individual makes a $750 contribution, and a family makes an average contribution of $1,250 towards their FSA plan. So if you add those two numbers together, the $5,615 and the $750, and then you extrapolate those numbers out actuarially, taking into account maybe an average 8.5% increase in healthcare costs, the total costs in 2017 will be $9,721 for a single plan, and which is just shy of the $10,200, and a family plan will be $25,956 in total costs, which is almost $3,000 less. Sorry, $2,000 less than the $27,500 cap. So here I'm just using this as an example to show in 2013, if your healthcare costs are around what the average is on the screen, based on the Kaiser Family Foundation, it would be very important to take a look at those healthcare costs and manage them much more closely, because you as an employer may be subject to the excise tax. And the other key piece of this is that 55 million people are now going to be eligible for health care in 2014, which is going to dramatically increase the costs and impact our health care costs based on their demand for service. And so it's really important, not only do we look at costs, we also look at the way we manage the costs. And that can be a whole separate webinar. I'm not going to address that today, but those two pieces need to work hand in hand. So what does this mean for an employer? There are going to be costs that are going to impact the employer directly. And these are going to be increases in premium contributions, healthcare account contributions, based on an increase in percentage of eligible employees. Now due to this hour definition, the 30-hour eligibility definition, there's now going to be a much more larger population. We're going to see less FICA savings because of the FSA cutback. And there's now going to be more premium increases due to the expanded risk pool. There are also fees that employers are now going to have to pay as a part of healthcare reform. These are direct fees. The first one was the patient-centered outcomes research fee, which took effect in 2012. That was where you paid $1 per employee in 2012 and $2 per employee in 2013. This fee is going to a quasi-government organization to help evaluate patient outcomes. And they're going to do research on that to determine the best way to manage healthcare costs. But there's now also going to be in 2014 a health insurance industry fee, a reinsurance assessment fee, and an exchange user fee. Health insurance companies are estimating, because they're going to be paying these fees on your behalf as an employer, are estimating somewhere in the range of about 7%. So your healthcare costs are estimated to go up about that amount, just based on these fees. So employers are going to be directly impacted by the healthcare reform come 2014. There's now also going to be an increased cost in HR administration, as we talked about with regards to communication and reporting. If you're going to be an organization that's going to eliminate your healthcare plan, there's going to be penalties that are going to be applied. And then of course there's the excise tax that you have to watch out for. So these are more indirect, not so much indirect costs, but the government and taxes costs can be a little bit better managed if there's no penalty that applies. Some of the indirect costs to employers, we're going to see a big shakeup in the next couple of years with regards to provider fees and network access, especially surrounding medical inflation. We've already seen this over the past couple of years with regards to accountable care organizations. These are parts of healthcare systems that reimburse, this is a mechanism that healthcare systems reimburse doctors and hospitals based on care provided rather than the number of patients that the doctors see. Or these hospitals and network organizations have found that doctors and hospitals who operate within an accountable care organization are better able to manage healthcare costs and bring them down, as well as compensate them in an appropriate manner. So I think we're going to see over the next couple of years a big shift in the way that happens, and more organizations taking part in that way to help manage healthcare costs. There is going to be an impact on recruiting and retention with regards to employees. So as healthcare costs go up, as employers look at their shift from 40 hours to 30 hours with regards to full-time, who's now eligible for health insurance, who's not, the exchanges, there's going to be a lot of confusion, could be some staff frustration. So there are some definitely recruiting and retention issues that are going to come about as a result of healthcare reform. And lastly, there's going to be a cost to employers to upgrade HR information technology. Depending on the types of systems you use today for your payroll and recording hours and so forth, now would be the time to take a look at that and make sure that you are in compliance and that the vendors that you're using can meet these requirements. Some employers might need to engage some consultants for legal review for benefit policies or HR consultants because now there's a bigger change rather than just looking at healthcare reform. And of course, there's the reporting and reconciliation piece that employers are now going to be responsible for. So a change in the way employers do their day-to-day operations with regards to HR. So what are employers doing with regards to compliance? I have some survey questions that were conducted by ADP listed on the screen here with regards to what employers are doing with regards to healthcare compliance, and this was done in 2012. It's not so old. So what steps have been done or currently be doing or definitely being done? This is for organizations that are 50 to 999 employees. And so to answer that question, can you estimate how many employees would qualify as full-time under the Shared Responsibility Act? Only 50% of employers have taken steps or currently doing or definitely do know whether employees would fall under that requirement. So it's a pretty low number. It's a measure to us to take a step back as an employer and say, I really need to pay attention. Whether that current health care plan has an actuarial value, meaning the plan is expected to pay at least 60% of the expected cost of covered benefits. Only 44% of employers have done anything about that to determine whether they're in compliance with that requirement. Then employers estimating how many employees have W-2 earnings that fall between 133% and 400% of the federal poverty level. This is to determine whether they meet the 9.5% test. Only 41% of employers have done anything about it. And then, the last one talks about the 9.5%, not having employees pay more than 9.5% for their health insurance. Only 32% of employers have done something about it or are doing something about it. So again, the message here is that while the survey was done in 2012, it's now 2013. We know as employers and HR have many responsibilities to pay attention to. Sometimes this doesn't come to the forefront. The message here is that employers need to start paying more attention to these requirements and ensuring that they are compliant. There is just the last piece of survey information I wanted to share with you. A private health insurance exchange organization called eHealth Insurance did a little bit of a survey for employers that are less than 50 employees. And 56% of those employers who 50 employees, the piece of the shared responsibility piece doesn't apply to you. 62% said that they don't understand healthcare reform at all, and 71% say they don't want to be forced to buy health insurance. They want coverage. So there's a big variety, again, from employers in the small employer market, less than 50, with regards to their understanding of healthcare reform and what to do. Oh, excuse me, this is the last question from the ADP slide. The potential for penalty amount that a company or an organization might have to pay under these regulations. Only 27% knew or were doing something about what the potential penalties were. So I think, again, this says a lot about employers and how much they know what the penalties are that apply. So as we finish up here, what can employers do? Well, they can definitely conduct a healthcare reform readiness assessment. We've actually developed a tool that allows employers to do a healthcare readiness assessment, and we take them through a process of evaluating many of the things that we've discussed today. And at the end of the assessment, the employer has documentation that they are compliant and ready for the changes. Employers should evaluate the total rewards impact to your organization, as we talked about in the beginning of the presentation. Take a look at the cost increases associated with healthcare reform, and most importantly, develop a comprehensive communication strategy. Employees have a lot of questions. They hear healthcare reform in the news. They're not sure what to believe. There is a lot of buzz about it, but I think it's important for organizations to provide a consistent communication message around healthcare reform. What's the organization doing? What are the upcoming notices that have to get sent out? Where can employees get questions and answers? There's many, many resources that are available, and employers can definitely take part in providing a good communication strategy. 4 big questions that I can leave you with regards to how to make sure you're compliant. Have you determined the eligibility for 2014? Have you determined the actuarial value of your plan? Have you looked at the W-2 earnings to see how many are below the threshold? And have you assessed the potential penalty of costs to your organization? These are the 4 key things that organizations need to focus on and help them move in the right direction for becoming compliant with healthcare reform. Lastly, I wanted to thank everybody for participating. We have the best bottom line on our website that gives regular updates on healthcare reform, as well as all the things that are happening in HR. So anyone is welcome to check that out and check into those articles regularly. And I'm also available for questions and answers via email or through my telephone number. Feel free to give me a call. So again, thank you for participating in the webinar, and now we'll open it up to questions.
Thank you so much. Thank you so much, Clifford. I really want to first thank you for your time. I do want to open the floor up for any questions. It was anything that was not clear to you. If you want to elaborate on anything, please type your questions at the bottom in the question bar, or you can actually raise your hand, and that way I can unmute your mic and you can ask the question directly. While we actually have people waiting for them to submit questions, I do have a question as well. It was amazing when I heard that you said a lot of the smaller companies, you said 62%, which is half, didn't even understand healthcare reform at all. It was like they didn't know what to do, what happens. So what do you know what steps the government's taking, or what steps people are taking to get these companies or these smaller companies on board and compliant if they don't even know about healthcare reform at all?
Actually, there was something that was recently prepared, which was sent out. It was done by the Kaiser Family Foundation in conjunction with the government, And they put together a video, um, a really well done video education process, which takes employers from the beginning of healthcare reform all the way up to where we are today, and focuses on what employers are supposed to do and what employees are supposed to do. That actually is on our website, on our Best Bottom Line. We recently published that video for employers to take pay attention to. There is also I'm not sure who's sponsoring this organization, but it's a nonprofit organization that's trying to get the word out to employers and employees about the exchanges. And so they have about 130 employees in this organization and 3,000 volunteers that are going to use a very grassroots effort to get the word out with regards to exchanges, especially for small employers, to buy health insurance through the exchanges and educate them. Those are the two vehicles that I'm aware of right now on what the government is trying to do to try and get the word out to the small employer.
Okay. I do have a question that came in. They first wanted to say great presentation. The question is, who at your company looks for offering package resources? And I think they're asking, I guess, who at your company does or looks at what the packages offer. Like, do you have anyone that looks at what different packages offer, or is that something a broker would do?
Well, we are also a broker, so we do that within our organization. So we look at the different packages that are available. We compare them to what's available in the exchanges, so help organizations determine whether it's best for them to buy directly through a health insurance company or buy through the exchange. So that's definitely something that we can do as well.
Okay. Another question about the Excise Tax that you were referring to.
Yep.
What is the penalties? I know that you were talking about penalties for not being compliant. Do you have actual numbers of the actual penalties? I don't know if it's based on the size of the company, what type of penalty they'll get. So could you go elaborate a little bit more into if they don't become compliant, either because they didn't know or they just didn't have the resource to become compliant? What are some of the penalties that they're facing?
The penalty that they're facing is a 40% tax. So it's a tax that the employee is going to have to pay to the government, and that tax is calculated. It's 40% of the total annual premium that an employer has to pay for health insurance.
Okay. Okay. Any more questions? Let me see who up here and see. Okay, and I do have another question as well that said information regarding a nonprofit organization or a company. Would this comply with being if you were a nonprofit?
Yes, so nonprofit organizations do have to comply with healthcare reform. There isn't any exemptions there specifically. So yes, as a nonprofit organization, you would meet all the requirements that we'd laid out today.
Okay, I hope that answers your question as far as being a nonprofit. Okay, and what would you do, and Clifford, from your professional experience, for someone that's just now like joining this webinar, they're just now starting to get on board with being compliant or getting some information moving forward, because we're now in August and 2014 to be here before you know it. What are some of the steps that you think that these organizations should take if they don't have the resources? I know a lot of companies that do go through either ADP or someone else that does their payroll and their benefits. How do they get them on board? I know that you talked about hiring a consultant. What are some other things they could do as well?
The best thing to do is to go to the organizations that provide your benefits to you. So if you're using a broker, they definitely should be able to provide you and guide you with regards to compliance and how to stay compliant. Depending on your payroll vendor, some of the payroll vendors do provide really good resources with regards to healthcare reform. And resources in the sense that they will provide a lot of education. They won't help you get stuff done. So generally your broker or your benefits consultant can help you get stuff done. The payroll vendors tend to provide a lot of information and leave it up to you to get this, do all the testing, do all the evaluation, determining whether you need to, what changes you need to make internally. Some other organizations that are very helpful, like I have referred to, the Kaiser Family Foundation has a really great resource on information about healthcare reform. It's very unbiased in the sense that they generally report on the legislation changes, on what impacts it has to employers. So that's another great resource for employers to turn to. Mm-hmm. Another great resource that's going to become available that isn't available today are the exchanges in your state. So if you, if you're going to be, if it's a state that's going to be offering an exchange, then they will have a lot of resources available to them to educate employers on the exchanges and what they should do.
Okay.
So I think that's generally the best place to go with regards to getting information. The last piece is the healthcare, your healthcare vendor, so your insurance company. Many of them do have websites that are specifically focused to healthcare reform. But again, they work very similarly like your payroll vendor, where they just post the information. They wouldn't be able to really objectively advise you. So if you go in and did an evaluation of your hours requirement and determine who's eligible and who's not eligible, they wouldn't be able to review that information for you and help you understand whether you're in compliance or not compliant. They'd mostly be able to just provide you information on the law and what you need to do and how to be compliant.
Okay. And this is going to be the last question because we're actually after 11 o'clock. Definitely email me or Clifford your questions. He does have his contact information on this last slide, so definitely, and you do have the slides as well in your inbox, so if you need to, definitely reach out to him because I won't be able to get to all these questions. I do have a question asking about where do 1099 SEs look for and how this will affect them.
Can you just say the question again, please?
Yes. I guess they're asking about 1099 employees.
Oh, yes.
How would that affect them?
Okay, so just very, very briefly, without knowing this person's specific situation, very briefly, 1099 employees are employees that are contractors, mm-hmm. That are hired by an employer to work on a specific project within the organization. And they're paid a fee for doing that work. Many employers pay that fee through payroll, but no taxes are taken out, and the employee gets a 1099 tax form showing that they earned this much income from this employer as a contractor. Earlier in the slide, we talked about the definition of employees, and we talked about full-time, part-time, seasonal. I didn't say anything about contractor. So it's a very good question, because employers who do hire contractors should use this as an opportunity to very, very carefully identify whether these employees are contractors or are employees. The IRS has very clear guidelines on who is an employee and who is a contractor. And there have been many audits that have been conducted over the past year or two from the Wage and Hour Division of the government to evaluate whether employees are paying contractors as contractors when they really should be paid as employees. And so this definition of who is an employee is going to bring to light the definition of a contractor. And so I would caution employers to use this as an opportunity to evaluate who the contractors are and clearly identify them and have the backup to show in the event that they are ever audited that these truly are contractors and we're paying them appropriately and therefore they're not eligible for health insurance.
Mm-hmm. And I have a quick question to piggyback on the contractors. Even if they do hire as a contractor, but some companies go through agencies that do offer, I guess, the benefit package. So some of them do get benefits, but just not through the company. Is that also a loophole that they can look at as far as we don't offer them benefits, but we outsource that to a third party that offers them their health care, their dental, and everything else?
That is perfectly fine to be able to do that as long as those employees are classified that way and they meet the contractor definition. So the organizations that hire those employees and pay them their benefits, the employees would be eligible for the benefits through those agencies. But as long as it's clearly defined that these 15 employees are being hired by an agency and we have a contract and we have a relationship with them and they're clearly defined as contractors through an agency, there should not be an issue there.
Okay. Well, again, Clifford, I want to thank you for your time. I really appreciate everything. For everyone that did attend the webinar, you will receive a recording. Even the ones that did not attend, they will receive a recording on their thank you email that's going to be followed up tomorrow morning. There'll be an attachment of the recording, so you can share this with your HR executives that wasn't able to get on the line today. So you can share this with them as well with the slides. Did you have any last remarks at all, Clifford?
Nope. I just thank everybody for participating today. And again, if you have any questions, feel free to send them to me directly. I'll be happy to respond.
Okay. Well, thank you so much. Everyone enjoy their day and have a great week.
Thank you, Bridget.
All right. Bye-bye.
Bye-bye.